I'm Dr. James, and welcome back to Pancreatic Cancer Warriors. Today, we're re-diving into a topic that has been on many of your minds: the connection between diabetes and pancreatic cancer. If you've been living with diabetes, you might wonder if it's connected to pancreatic cancer. Let's break it down together and shed some light on this important subject. First things first, let's talk about long-standing diabetes and its relationship with pancreatic cancer. Now, I know this might sound a bit scary, but it's important to understand that having diabetes for a long time can slightly increase your risk of developing pancreatic cancer. But here's the key word: slightly. We're not talking about a massive jump in risk, just a small increase that's worth being aware of. Now, here's something interesting that's caught the attention of researchers recently. If you're over 50 and suddenly develop diabetes out of the blue, it could potentially be an early sign of pancreatic cancer. I want to emphasize the word could here, because it's not a guarantee, just a possibility that doctors are keeping an eye on. But before we go any further, I want to make something crystal clear. Most people with diabetes will never develop pancreatic cancer. I repeat, the vast majority of folks managing diabetes will not face this particular challenge. So if you're sitting there worried about your diabetes diagnosis, take a deep breath. We're just talking about awareness here, not predicting the future. Let's dive a little deeper into the science behind this connection. It all comes down to how our bodies handle sugar and insulin. When you have diabetes, your body struggles with insulin resistance, meaning it has trouble using insulin effectively to manage blood sugar levels. This ongoing battle with blood sugar can create an environment in your body that might, in some cases, contribute to cancer cell growth. Think of it like this: cancer cells are greedy little things that love sugar. When there's a lot of sugar floating around in your bloodstream, it's like leaving out a buffet for these unwanted guests. But remember, this doesn't mean sugar directly causes cancer. It's more about creating conditions that cancer cells find favorable. Now, you might be wondering, Dr. James, what should I be looking out for? Great question. One of the key things to pay attention to is any unusual shifts in how you're re-managing your diabetes. If you've had your diabetes under control for years and suddenly find it becoming much harder to manage, that's something worth discussing with your healthcare provider. Maybe you're needing more insulin than usual, or your blood sugar readings are all over the place despite following your usual routine. These changes don't automatically mean cancer, but they're definitely worth investigating. Your body might be trying to tell you something, and it's always better to listen and check things out. This is where the importance of regular checkups comes into play. I can't stress enough how crucial it is to stay on top of your health, especially if you're living with diabetes. Your doctor isn't just there to refill your prescriptions. They're your partner in keeping an eye on the big picture of your health. During these checkups, don't be shy about bringing up any concerns or changes you've noticed. Maybe you've been feeling more tired than usual, or you've lost weight without trying. These could be signs of your diabetes changing, or they could point to something else entirely. The key is to speak up and let your healthcare team investigate. Now, I know all this talk about cancer risks can feel overwhelming, but I want you to remember something important. Knowledge is power. By understanding the potential link between diabetes and pancreatic cancer, you're not inviting trouble into your life. Instead, you're arming yourself with information that can help you stay proactive about your health. Let's talk about some positive steps you can take. If you're managing diabetes, you're already doing a lot of great things for your health. Keeping your blood sugar in check, eating a balanced diet, staying active. These are all fantastic habits that benefit your overall well-being, not just your diabetes management. Consider adding some extra cancer-fighting foods to your diet. Things like berries, leafy greens, and whole grains are not only great for managing diabetes, but also pack a punch when it comes to cancer prevention. It's like hitting two birds with one stone, and deliciously so. Exercise is another powerful tool in your arsenal. Regular physical activity helps manage your blood sugar levels and has been shown to reduce cancer risk. Even a brisk 30-minute walk most days of the week can make a big difference. Plus, it's a great way to clear your mind and reduce stress, which is important for overall health. Speaking of stress, let's address the elephant in the room. Learning about potential health risks can be anxiety-inducing, but here's the thing: stress itself can negatively impact both diabetes management and overall health. So, while it's important to be informed, it's equally crucial to find ways to relax and enjoy life. Maybe try incorporating some stress reduction techniques into your daily routine. This could be meditation, deep breathing exercises, or even just setting aside time for a hobby you love. Remember, taking care of your mental health is just as important as managing your physical health. Let's circle back to the main point. The link between diabetes and pancreatic cancer is something to be aware of, not something to lose sleep over. The vast majority of people with diabetes will never develop pancreatic cancer, but by staying informed and proactive, you're putting yourself in the best position to catch any potential issues early. Here's what I want you to take away from our chat today. First, if you have diabetes, keep doing what you're doing to manage it well. Second, pay attention to any significant changes in how your body responds to your diabetes management. And third, don't skip those regular checkups with your healthcare provider. Remember, you're not alone in this journey. Your healthcare team, your loved ones, and communities like Pancreatic Cancer Warriors are all here to support you. By staying informed, proactive, and positive, you're already doing so much to protect your health. Before we wrap up, I want to leave you with a thought that I hope will stick with you. Your health journey is unique, and you are your own best advocate. Trust your instincts, ask questions, and never hesitate to seek answers when something doesn't feel right. Staying proactive with your health can make a big difference. It's not just about preventing problems, it's about embracing a lifestyle that lets you live your best life. So keep up the great work you're already doing, stay informed, and remember, knowledge is your superpower in the fight for good health. Thank you for joining me today on Pancreatic Cancer Warriors. Until next time, take care of yourselves and each other. This is Dr. James, signing off.